If you cough, wheeze, or feel out of breath during or after exercise, it may be more than exertion causing your symptoms. You might have exercise-induced asthma. As with asthma triggered by other things, exercise-induced asthma symptoms occur when your airways tighten and produce extra mucus. If you have exercise-induced asthma, also called exercise-induced bronchospasm, physical exertion may be the only thing that triggers your symptoms, or exercise might just be one of the several things that trigger your asthma. But having exercise-induced asthma doesn't mean you shouldn't exercise. Proper treatment of exercise-induced asthma and precautions can keep you active, whether you're strolling to the park or running a race. Factors that can trigger or worsen exercise-induced asthma include cold air, dry air pollution such as smoke or smog, high pollen counts, having a respiratory infection such as a cold, chemicals such as chlorine in swimming pools. So there aren't particular exercises you should avoid when you have exercise-induced asthma, but activities that make you breathe hard are more likely to trigger the symptoms. For example, aerobic exercises such as running or playing basketball, hockey, or soccer is more likely to trigger these symptoms than is weightlifting, golfing, or moderate-paced walking. Likewise, exercising in cold weather also can increase asthma symptoms because you're breathing in a lot of cold, dry air. But hey, don't let that discourage you. With proper treatment, you can do intense aerobic activities and cold weather workouts without asthma symptoms slowing you down. Possible asthma complications include poor athletic performance, permanent narrowing of the airway, which causes difficulty breathing, emergency room visits and hospitalizations for severe asthma attack. Also called rescue medications, quick relief medications are used as needed for rapid, short-term symptom relief during an asthma attack, or before exercise if your doctor recommends it. These inhaled bronchodilator medications include albuterol, levobuterol, and perbuterol. For people, 1 to 2 puffs of albuterol or another inhaled short-acting beta agonist 10 to 15 minutes before exercise is enough to prevent symptoms for up to 4 hours. So how is somebody diagnosed with exercise-induced asthma? Something called the lung function test, a spirometry test, which measures how well you breathe, is the preferred test for diagnosing asthma. During this 10 to 15 minute test, you take deep breaths and forcefully exhale into a tube connected to a machine called a spirometer. If certain key measurements are below normal for a person your age and sex, your airways may be blocked by inflammation or obstructed. This is a key sign for asthma. Your doctor may ask you to inhale a bronchodilator drug used in asthma treatment to then open up your airways. Then you retake the spirometry test. If your breathing improves significantly, it's likely you have asthma. So how do we prevent this exercise-induced asthma? Although you can't prevent the development of exercise-induced asthma, you can take steps to prevent flare-ups of the condition. You should warm up about 10 minutes before strenuous exercise. Do your best to avoid colds and other respiratory infections. Don't do strenuous exercise when you have a cold. You should avoid allergens when exercising. Learn to breathe through your nose to warm the air before it enters into your lungs. You should keep your mouth and nose covered during exercise in cold weather. It's just a smarter thing to do. And lastly, you shouldn't avoid exercise just because you have asthma. Staying in good shape can ease asthma symptoms in the long run.